And I wanted to bring on a guest, a man that works in the medical community. His name is Dr. Mark Anderson. He's practiced medicine for 24 years. He's a partner at Executive Medicine of Texas, where his practice focuses on age management and hormone optimization. He maintains a teaching position, too, at Southwestern School of Medicine right here in Dallas. Mark, thanks for being here on the Big BAP.
Thank you.
So I wanted to ask you, if you could just outline the folks, now that we see this law falling apart at the seams, we see that more people are losing insurance than are gaining insurance. We don't know who has paid. The system itself, Obamacare, was ill-conceived and even more ill-executed. So give folks a snapshot. What are we going to be seeing in the next 6 months, in the next year, in the next 5 years in medicine in America?
In specific with the Obamacare right now, and the patients who are signing up for it are finding out that there's not very many physicians that are participating in it. So it's not improving their access to health care because they're not finding the docs that are going to be able to see them. It's going to limit their care, that they're in these plans now, so their choice gets limited. That if you wanted to go to a cancer specialty center, say in our area, MD Anderson in Houston, that choice is going to be limited. You're not going to be able to do that. Over the next several years, you're going to see they're going to rule that these plans, because they're subsidized by federal funds, are, and in fact, federal programs, and it's going to give the federal government more regulatory oversight, just like it has with Medicare, Medicaid, and other federal programs, to mandate what can go on in those and limit patients' care and choice.
Mark, will Americans have less choice or fewer choices when it comes to their medical care?
When it comes to the medical care, it's going to be fewer choices. They may still have choice in which health plan they participate in, and those will still be managed by the for-profit commercial health plans, but basically it'll boil down to one set of rules and one set of regulations that the federal government will dictate.
Will Americans be spending more for their health care or less for their health care under Obamacare?
Well, it's actually going to end up being probably, this is close to the same or more. It's not going to control costs, so you're giving up choice of freedom, or freedom of choice, in exchange for no cost savings, and probably not any great quality improvement in our health care either.
Okay, so that leads me to the question. And by the way, the analysis shows that at the end of the day, in the next 10 years, we'll still have 30 million people uninsured. So the big question on my mind is, why the heck did we do this? Why did we spend over $3 trillion, and counting, by the way, to get this law into place? I am forced to conclude, Mark, and maybe you share this or maybe you don't, that this was never about health care coverage. This was never about health care. This was about control of the Democrat Party over we the people.
I personally agree with that, and I think that the goal here is that it's just a transition to nationalized health care where all of us will be more dependent on the government, which gives them more control over us.
Mark, if folks want to find out more about you, Dr. Mark Anderson, my guest right now, where can they go?
Our website is emtexas.com.
emtexas.com. Dr. Mark Anderson, practiced medicine 24 years. He knows of what he speaks. He even teaches still. Thank goodness. Southwestern School of Medicine. Thanks for making time for the Ben Ferguson Show with me, Chris Salcedo, here on the Big BAP.
Thank you, Chris.
You betcha, buddy. Talk to you soon.